Well, we are most fortunate to have Dr. Ann Schmidt with us, the medical director at Blue Cross Blue Shield, via the new tele-interviewing that's going around all over the place. You see it all over television. And so we're doing it too. And we're going to be talking about COVID-19 today. And, it's been around a long time now. And we're going, I guess, to our 9th month of this situation. And Dr. Schmidt, where do we stand as far as Blue Cross Blue Shield and as far as a doctor on this whole situation with COVID-19?
Yeah, thanks so much for having me to talk about this important topic, as you said. And we're doing it remotely because we're practicing safety, for COVID, which really is the most important thing that anybody can do, especially the senior population, but really anybody. Prevention is always the best cure, right? So the more we can do to prevent the spread of COVID, the better off we will all be. I know, like you said, Bob, we're going into our 9th month and people can get a little bit weary, a little bit tired of practicing precautions. So I think it's really important to have a reminder every once in a while about how important it still is to follow all the CDC recommendations.
Let's talk about masks for a moment. There are all different kinds of masks out there, and is there some people are just wearing a cloth thing that they pull down and then they pull it up. It looks like something you would do if you're going to go rob the bank. You can put one of those masks on, sunglasses, and a baseball cap. And I always say, what are the three words to success? You know what they are when you're dressed like that?
What's that?
Stick them up. Anyway, so the thing about the mask, I have a very unusual mask. It's made out of plastic. And so you can see my face. And you want to see the people give me the second looks with something like that.
Okay, so you have a face shield with your mask?
Yeah, the whole mask is plastic. The whole thing is plastic. I should have brought it with me. I forgot to bring it with me.
Oh, that would be good. But I think that's a great point that you make. So just real quickly at a high level to remind everybody what the CDC recommends, that's, as you said, wearing masks in public. It's maintaining 6 feet of distance between yourself and people who are not members of your household. And it's frequent hand washing or hand hygiene. And if you can't wash your hands for 20 seconds with soap and water, we want you to use hand sanitizer with at least 60% alcohol in it. And that's a really good substitute when you can't wash your hands as frequently as you like. So it's sometimes a good idea to have like a little to-go pack. So if you're going to be out and about, you have all those things handy. You have your mask, you have your hand sanitizer, and if it's summertime, you've got maybe some cooling towels, maybe some water to bring with you. But just have that all ready to go so you can pick it up as you head out the door. And when you talk about masks, you're exactly right. We have a lot of options, and we have a lot of options that work really well. Because the purpose of a mask, if we remember, is to protect other people. So my mask protects you because I might have COVID and I might not have any symptoms. I might not even know that I have it yet. So I could be out in public and my mask will protect you from breathing in any of my respiratory droplets if I cough, if I sneeze, even if I'm speaking. So we want to wear a mask to protect other people.
The other thing is about the sanitizers. They're all over the place. How do you know that sanitizer is 60% alcohol? Because some of them are foam, some of them are liquid, the thick liquid, some of them are a spray. There's all kinds of different kinds of these hand sanitizers. How do we know? And there was something recently about, a couple of months ago, the particular sanitizer wasn't any good and they recommended not to use it.
That's right. That's another really good point. Hand sanitizer is only effective if it meets the CDC and FDA recommendations. And those are hand sanitizers. Every sanitizer, if you turn the bottle around, should say on the back the active ingredient, and it should be at least 60% ethyl alcohol. So I think you mentioned that some hand sanitizers have been taken off the market or not recommended for use because they actually contain methyl alcohol. So you want to look for 60% at least ethyl alcohol. More is fine, but 60% is the minimum that you need on your hand sanitizer. Foams, gels, sprays, they'll all work effectively. So whatever you feel comfortable with and whatever you'll use the most, that's the version that I would recommend that you get, and just look for that 60% ethyl alcohol label on the back.
What about the possible vaccines or all these things? We don't know what's happening. They think by the first of the year. They're not sure about that. Hydroxychloroquine, you hear about that. You don't hear about that. All of a sudden, it was good. Now it's not so good. It's very confusing to most of us, Dr. Schmidt, on what is really going on out there. It seems like to the regular person out there that everybody's pushing the most expensive stuff and not the least expensive stuff.
Those are all very good points. There's just so much that we don't know about this virus. It's a new virus in humans. We're learning as we go, and I know that leads to a lot of confusion and a lot, frankly, of anxiety, because when we don't have answers, we tend to get more anxious. I think the first thing I would recommend, if people want information, the Centers for Disease Control and Prevention has a great website, cdc.gov, and their very first link is coronavirus. You can click on that link and you can do anything from check your symptoms to find out about trials, to find out about, medications, recommendations, like we talked about, the mask wearing, social distancing, washing your hands. They've got a really great list of resources and really simple information. So if you want a reliable source, that is a great place to start. As far as vaccines go, we have multiple vaccines in various phases of trials. There are 3 phases of clinical trials. Phase 3 is the one where we look at the effectiveness in a large group of human patients, and we've got several vaccines that are already in that phase. There's one in Alabama. We're enrolling people in several of those trials. One's based at UAB, some are based in St. Vincent's, but they're national trials, and we're looking for volunteers who would want to participate in a trial, knowing that it being a trial, some people will get the vaccine and some people will not, but it's really to find out how effective and safe these are.
The last question I have on this is the testing. We found out just by calling around that some of these places are charging for testing, some are not charging for testing. You have to have an appointment to test. Do you test if you don't have any symptoms?
That's a great question. If you've been exposed, if you think you've been exposed to COVID, even if you don't have symptoms, that would be a time to get a test to see if you actually have been exposed maybe before. Like we said, you won't show symptoms for maybe 2 to 14 days, but you still could be infectious and infected. So that would be a time to get tested. Certainly if you're showing symptoms that could be COVID related, like fever, a wet cough, body aches, and then we have some random symptoms that sort of are less common, but certainly still associated with COVID, like GI symptoms, nausea, diarrhea, headaches, fatigue. So a lot of symptoms can be related to COVID. So if you're showing any of those, that would also be a time to get tested. So we know that there are sites that you can drive through and get tested. Most of those will file those tests with your insurance carrier. There are places that are charging up front. I think it's important for people to know that the CARES Act, the federal CARES Act, requires that testing that's done for medical purposes. So if you're trying to diagnose or treat somebody with COVID, those are all covered with no copay, with no member cost share. So even if you pay up front for a test, just know that you can submit that claim then to your insurance carrier for reimbursement.
Very good information. Well, thank you again for being with us. And again, the website to go to to get more information from Blue Cross Blue Shield is
alabamablue.com.
alabamablue.com, one of my favorite websites. Thank you again, Dr.
Thank
Schmidt.
you. Thank you.